Welcome everyone. My name is Johanna Allen. I'm a nurse midwife here at Viva Eve. And today we're going to be talking about caring for the newborn baby. Oh, wait, oh here, I'll just check it. Okay. Technical difficulties, excuse me. That's some information on me. We don't really need to focus there, but I am a nurse midwife and I'm happy to be here tonight with you all. And then this is some information on Viva Eve. If you're not a patient at Viva Eve and you want to learn more about the organization, feel free to check it out online. Today we'll be talking about some things that you can expect in caring for your baby in the first month of life. Then we can touch on breastfeeding and formula feeding and some things to check out with your newborn. So especially for new parents, I know a huge question is, sorry, what will my baby need?
No, it's totally fine.
Sierra was going to be asking some questions, but we'll tap back into that. But
yes,
so this is exciting for new parents to think about. I know everyone like around the baby shower, etc., the end of pregnancy is trying to gather all the materials necessary to make that transition into welcoming your baby home nice and smooth. And so one thing to prepare for is diaper changes. So whether that looks like buying disposable diapers or using washable diapers, just getting all those supplies ready and having a lot on hand, your baby will probably have 6 to 10 dirty diapers a day. So it's a big commitment. One thing you can also do is recruit people to help you change those diapers. Hopefully the parents of the baby are involved, 1 or 2 of them, and then whatever support team you can recruit. Go ahead and take advantage of anyone who offers to help change diapers. You will really appreciate it. And then they do cry. The newborns, one of their ways of communicating is through crying. So if they need something, then that is a way to signal that. Really gets your attention and helps you wake you up if they're hungry in the middle of the night. So we can go into more strategies to comfort babies and address crying shortly. But you can just expect that it doesn't necessarily mean that something's wrong, but just a signaling that something maybe needs to change or be addressed. And then is it to kind of comfort your baby and also to just kind of promote development and well-being. We recommend holding your baby, interacting, whether that's like talking with your baby, singing with your baby, like touching just the hands and feet, and massage, like gentle massage can even be nice. And then also making sure to get that car seat and bring it to wherever you're giving birth at the hospital. Make sure you bring it so that you have a way to get your baby home. And it gets installed facing backward into the car. Actually, you can I do recommend looking at the instruction manual on the car seat because each one is a little bit different, and practicing before you go to welcome your baby and bring your baby home. Try practicing installing it into the back of the car so that it's not 6 a.m. you're trying to get home and you're exhausted and you're trying to figure out this puzzle of a car seat. I also recommend stopping by your local fire station because most of them have classes or some kind of just informal instruction available. Maybe double check before going by, but that's a good resource if they offer that.
Interesting.
Yeah.
Never thought
fire
that.
people. Yeah. It's I guess it's just a way they meet community needs. So pretty cool. Yeah. And then for feeding your baby, just make sure that you're kind of paying attention to some of their cues, because we do recommend with a newborn to feed the baby every 2 to 3 hours. They just have a tiny little stomach. It's hard to show you, but a small marble. It's very small when they're first born, and it does gradually grow, but they don't need a lot at one time. They just need to eat frequently because their stomach then empties quickly. And so that's why we just recommend these frequent feedings to keep their blood sugar levels stable, just help their body function, just like we need to eat regularly. And then some of the cues we can get more into as well for when they want to eat. Crying is a clear one. And then burping your baby afterwards, just making sure that the baby is either kind of vertical in your arms and just like softly tapping your baby's back after a feeding. That just helps those extra gases that they produce, is just like they're learning to eat, whether it's from breast or bottle, and like a lot of air can get into their mouth and digestive system. So the burping just kind of helps bring it out, helps them feel more comfortable, and maybe just helps prevent them then vomiting up some of what they eat. That might happen anyways, but at least it can help them feel better and prevent that. And you could also just kind of have them on your lap with their head a little bit elevated, and then just kind of pat, or like on your forearm if it's secure, or just on your leg, which I can't show you easily right now. And then just again, softly patting the back, just the idea being the head above the stomach, and kind of just gentle pats. And then sleep, they will sleep the majority of their first few weeks, or even months and beyond. So, just giving them a quiet and safe place without loose blankets and pillows or toys, which I know is like not the image we have, like a crib filled with toys and stuffed animals and coziness. But just, if you think about like if something falls on their face, they're not able to remove it. And so there's a risk of suffocation. And so it's recommended that babies are like either wearing in the form of clothing, their warm layers, or if they have a blanket, that they're swaddled in it, wrapped in it. And that also the swaddling can help them to sleep and feel cozy. You can imagine inside the uterus and the womb, all curled up. They're used to being kind of contained and to feel safe in that way. So swaddling mimics that kind of containment. It maybe seems like a restraining device and not very comfortable, but you'll see like they do like it, and it's quite an art, swaddling. I wish that we were all in person together, because it would be very useful to demo. Usually if I'm in the hospital with a family, I'm teaching them, or birth center home, like to swaddle before they leave, so that they have that skill. So ask your provider who's with you in the postpartum period to show you on your baby, so that you can see. And then babies do sleep on their back. That is again to prevent suffocation, and because they at first have a hard time rolling on their back themselves. So put them back to sleep. Back to sleep.
Cool.
Yeah.
So now we went over kind of the overview of baby's needs. Let's talk about bathing and umbilical cord care. Kind of what are the necessities daily, every so many days, like kind of what that looks like.
Cool. Yes. So every day you can imagine like there's a lot of skin folds in certain areas of your baby. The neck is one of them, and then the genitals. So we do recommend daily cleaning of those body parts, since stuff can get stuck in them, especially when they're like eating. Maybe some like breast milk or formula comes down their neck and gets stuck there, dirt, skin cells. So it's just nice to wipe that off every day with like a clean, moist cloth, or even a baby wipe. And like for male babies, just making sure to clean all around the testicles. And then female babies, like kind of checking between the folds of the labia of the vagina, just to make sure that like no feces gets caught in there. There's tons of skin folds. So then the cord stump, that, in pregnancy, I think probably everyone knows, but just to review, the cord is connecting the mom or in the placenta with the baby. So all that nutrition, oxygen goes through the cord. And then once the baby's born, using its own lungs, getting nutrition from milk, then it doesn't need that cord anymore. So it is this, after it's cut, there's that little stump there, and it dries up and shrivels up and becomes this like brown, wrinkled kind of thing that's sticking out from the belly button. So it usually falls off on its own, typically within 2 weeks. And until then, just keep that outside of the diaper, just because you don't want it tucked inside the diaper, the belly button and the cord, because then, fecal matter, urine can get on it and just raise risk for infection. So you can keep it outside the diaper and then clean that area also with clean cloth and water. And don't remove it yourself, just because there's important healing going on under that. It's essentially a scab, that brown wrinkly mass. And then definitely just let the provider know you're probably going to have regular checkups with your baby's healthcare provider in the first few days and weeks after birth, but let them know if it doesn't fall off, like at least by 4 weeks. And also let them know if you're noticing a lot of like redness, swelling, oozing of that area, or very foul odor. And then bathing of the whole body doesn't need to happen every day necessarily, but it can happen every couple of days before that cord stump falls off. You don't want to like submerge it underwater. So at that point, just bathe your baby with a soft, moistened towel. And then after the cord stump falls off, you can use like a shallow basin or sink. You can put like a couple inches of warm water. Just be really careful to test the temperature. Use like the inside of your wrist or the back of the hand is just like a sensitive area. And then making sure it doesn't get too hot to scald them, or then if they're in that water that it's too cold and then your baby's just, losing temperature and becoming too cold. And you can also just like take water and pour it over your baby. Be careful not to like douse their face in water. You can kind of towel off the face and then you can pour water over the rest. And it can be like a nice bonding time. And, you can just put on some soft music and do like gentle massage as you're washing. Use a gentle unscented soap. There's a lot of like, specifically baby soap. So just keep an eye out for those ones that are very simple, non-irritating. And also make sure that when you start bathing your baby in a basin or sink, stay with your baby the entire time to, I don't want to like go into all these scary things, but it's just important to not allow for any risk of drowning or so stay with baby and then keep one hand under baby's neck so to support the head and keep it out from not submerging in the water. And I should say, like, just in general, I think new parents sometimes haven't been around kids before their baby's born or new babies, and just remembering and holding the baby at any point to support the neck. And you can see this mom here, like she has her kind of hands right below the neck, or, you could even put a hand directly behind the neck to just, they're still developing their muscles. And so they can't necessarily have head control. Then their head might flop around. And you just don't want them to get too hurt. So providing some neck support when holding them, or like propping baby against the shoulder too can work. But they're strong, and sometimes they like will motion away. So be prepared for them to like wiggle away. They're stronger and more active than you think.
There's been a time where I was holding a baby and like pretty newborn, and they were just like energetic and like thrashed. And I was like, oh my gosh, they break the baby. Yeah. It's like, okay. Yeah, no, they're just like using those muscles.
Ready to go.
They don't have space. Awesome. So you did mention before you're gonna share some tips about crying and what to do.
Yeah.
So let's talk about my baby is screeching and wailing.
Right.
What do I do?
Yeah, probably like one of the number one questions that people have. So some things to think of when baby's crying is, is there a dirty diaper involved? So definitely check the diaper, smell, kind of peek in the edge of the diaper, and change that if baby's crying. And then maybe think about, is baby hungry? Maybe it seems like baby just ate. It might just seem like your baby's always eating, sleeping, and pooping. And that's good. That's just kind of how the first few weeks roll. And they might have like cluster feeding where they're, I said like yeah, feed your baby every 2 to 3 hours on cue, but those cues might actually be clustered together. So it's like, I'm feeding my baby every hour. What's going on?
Mm.
And that's okay. It usually will then space out a little bit more at some point in the course of the 24-hour day. But it's hard. This is all challenging, and but also you can get through it, especially I think just the knowledge that like I'm not alone in this and I'm not doing something wrong is helpful.
Mm-hmm.
So then yeah, feeding baby and adjusting the temperature to make sure it's not too hot or cold in the room. Swaddling again can be helpful. And then if they're like in an environment where maybe it's hard for them to sleep, they're sleepy and maybe it's just too loud, a lot of people talking, not really in quiet voices, then just try removing them from that environment. And it can help to rock them, swing them, walking, holding them. Again, gentle massage just to relax. Sometimes some of those things might be a little overstimulating if they're already at the point of like really heavy crying. But then, yeah, just like gentle talking and singing and humming, and they kind of know they have their people around, but nothing like super loud, probably. And they love motion. So whether it's in your arms or they're in a swing or a car seat in the car, walking with them in a stroller, those things can all help. Apparently my parents put me on at the top of the dryer.
I've heard that one before.
Yeah. Which sounds, go for it. But also like, I don't know if it's like a tiny dryer, it might be a little dangerous, but if you're there with them for a while, then maybe that's just fine.
With the car seat on there, just
well, that
away.
car seat, yeah. So yeah, that's a strategy that people have used. So go for it.
So those are all great tips of what you can do. Let's talk about now like kind of what it means and how to kind of cope with that, because you touched on that just a few moments ago about like how there can be an emotional toll on parents as well, like while the crying is happening, and you can feel a little frustrated and alone during it.
Totally.
So
especially in the middle of the night, dark hours. So that again, like crying is part of their communication. So sometimes they can give cues, or typically they'll give cues before getting to that point. You might see them like wrinkle their forehead, or like move their head away from whatever stimulus is not appealing, turning the head, and then fussing and kind of just like wiggling and maybe like raising their arms. And so you'll get to know your baby. Each baby's a little bit different. You're gonna pick up on those cues probably, even if it's subconsciously. And then if you can kind of figure out what they might need before the crying starts, that's ideal. I should say too, back on that list of when we were talking about changing and feeding, it might be helpful to, like, if the diaper needs changing, do that first, because then some of those other things that you're doing to kind of pacify or, soothe your baby, what might put them to sleep. And then if you have to like change the diaper and they've already fallen asleep, it might be a little more complicated. So kind of useful to start with diaper change if that's necessary. And then hunger cues, take some specific signs like sucking on the hand, making a sucking motion with the mouth, and then rooting or like looking for the breast. So that could also be like turning the head to look for the breast, especially if like anyone's holding the baby, they might start looking around like, are you feeding me? And then, so this is interesting. Crying is a part of baby's neurological development, which is like a more recent finding. For a long time, the term colic was used to describe like babies, like
fussy babies, right?
Right, exactly. And it was thought like, okay, they're having gastrointestinal irritation, or gassy babies, they're fussy babies, which like still could be true. Maybe if someone's breastfeeding, then try to kind of figure out, maybe there is something I'm eating that's a little bit more irritating to my baby. Maybe a certain kind of formula is worth paying attention to. But is not necessarily the only cause. There's a lot of neurological development that is happening. And so the crying are usually like peaking around 6 to 8 weeks as a part of that. I think that's helpful to know, just because it's like, independent of whatever you're doing, whatever measures you've taken to take care of your baby, you've changed the diaper, you've fed your baby, you're holding your baby, you've been walking around with your baby for 2 hours and baby's still crying. That is hard. That is like a lot of things probably going on in a lot of parents' minds. Like, I haven't been sleeping much. And then I have done all these things and my baby is still like mad at me. Maybe it feels like there's anger involved, but it's not something that really can be taken personally in that way. It is just kind of, again, a part of their development and a developmental stage that they get through. It usually gets better. So, that might be the case early on. It might peak, but then it usually does get better after a couple months of life. So just keep that in mind. Again, with all those factors, especially not sleeping and, kind of depending on support systems, if someone feels really alone and maybe some people live in New York and don't have family around, maybe, someone is single parenting and feels like a lack of support, it can just feel really frustrating and isolating, again, in those dark hours of the morning. So be sure to reach out to whoever you can. Reach out to your healthcare provider if you feel like you're overwhelmed and you need more resources. And just if you are getting to the point when, like, in that moment of your baby's crying, I'm feeling overwhelmed and frustrated, just put down baby. Don't shake baby, because there is neurological damage that can happen if babies are shaken. Because you can imagine just like moving the brain inside of the skull. But instead, put baby down in a crib, safe place, and you can just walk away. Just leave them. It's okay. Everyone's gonna get through it. Just set baby down, walk away, take some deep breaths, take care of yourself, and come back to your baby when you're ready. And you're not alone in this.
No, that's great. But with that being said, you said if you're worried that something is wrong, you want to talk to your provider.
Yeah.
So on the next topic we're going to move on to is, what are the signs for concern? Like,
Right.
obviously you touched upon, it can be normal for the baby to be fussing and crying for a couple of hours. They're just having a tough time and,
Right.
maybe
Yeah.
like haven't slept well that night before or just having a moment.
Right.
But what are the signs that you should also be looking for in case something is going on?
Yeah, and that's a fine line. It's like hard to tell, and there isn't like a hard fast rule in regards to crying. It's like, if it just is seeming excessive and you have an intuition of something's wrong, or it's like a shrieking sound that is kind of like associated with pain, and you've done everything else again and they're still crying, reach out to your baby's healthcare provider. Other reasons that we'd want you to reach out is if your baby is like listless, unresponsive, you're interacting with your baby and there's no response, like eyes are either not opening or not closing, and floppy tone. That's worrisome. So call 911 in that case, and definitely reach out to the pediatrician or baby's provider. Yellow coloring of the skin or eyes can indicate jaundice, which can happen with the baby's immature liver and also in processing red blood cells. So usually that's like something that providers paying a lot of attention to the follow-up visits in the first days of life, and definitely make sure that you share that, especially in the first 24 hours of life, as well as later on. Sometimes there'll be like a little bit of yellowing, but the provider will just decide, let's watch this, see if it improves. Or maybe they might want to do a blood draw to check some of the labs. Fever in a baby is 100 degrees or higher. So let your healthcare provider know if your baby has a fever. It's lower than an adult fever. And the temperature, again, easier to do in person. So ask your baby's healthcare provider, or like if you're in the hospital for the birth, before being discharged, just pay attention to, okay, how are the nursing staff, how are they taking the temperature? It should be like the thermometer is kind of inserted under the arm and the baby's arm is pressed down. If your baby is not feeding well, and not sucking, also let them know, because they need to eat, and it could indicate that there is some sort of, a lack of something contributing to a lack of energy and vitality, or again, if they're difficult to wake. And then any difficulties breathing, if they have, sometimes after birth, babies their hands and feet will be kind of blue. That's okay in the first days of life, as especially the first like 24 hours of life, as their heart is actually the structure of it changes. And so as that's happening, there might not be so much blood flow to the extremities. But if there's blue around the mouth or the trunk of the body, that's very concerning. So definitely let the provider know. And then your baby might be dehydrated if you're not seeing 6 diapers or more a day, might not be getting enough to eat, might be dehydrated, or there might be some sort of intestinal or bladder blockage. And then again, with the cord, if you're noticing like redness or pus coming out of it, all reasons to contact the provider.
Cool. Let's move on to talking about feeding.
Yeah. So again, cues, all those cues we talked about is the most important thing to pay attention to. Let that be the main guiding factor in when to feed your baby. But sometimes your baby might be sleeping, and that's kind of nice, and everyone can rest. I recommend the next class, we're going to be talking about the postpartum nest and taking care of everyone involved, especially the birthing person or the mother. And so parents and caregivers in general, sleep when your baby sleeps. But set an alarm, because in the first weeks of life, it's really important, again, for babies to eat regularly. So if you are not awake and you can't necessarily see those clues, at least you're waking up to feed your baby at least every 2 to 3 hours. Check in with your care provider. They might, if your baby's been feeding well throughout the day and you're exhausted and your baby's sleeping okay, they might be like, okay, like that's fine to space it more like by 4 hours at night. But I would just check in with them. If your baby is gaining weight nicely, that's probably fine. But if there are any concerns about weight gain or dehydration, definitely make sure to set that alarm for at least every 2 to 3 hours. So that kind of looks like your baby's eating 8 to 12 times in 24 hours. Just remember, like their clock is the full 24 hours, whereas ours is like sun up, sundown, or whatever. They're feeding around the clock. And so it's a good sign if your baby is pooping and peeing and gaining weight. If your baby's getting enough to eat, that's very reassuring. It's a great sign. And then for families that choose to formula feed, just make sure that you have all the equipment that like the sizing fits your baby's size. And then just make sure that you're following instructions for proper cleaning of the equipment, and then making sure that the formula is the right temperature to be served to your baby.
And that applies too if you're like pumping and
yeah,
bottle feeding,
right?
in addition
Exactly.
to breast, if you're like sharing
Exactly.
the feedings with your partner.
Totally. Yeah, exactly. Good point. Yeah, absolutely. All that just requires feeding, because anything that has any kind of a carbohydrate in it, bacteria are just going to really love. So can build up in all those little crevices of the bottles and nipples, and if you're pumping the like tubing and stuff. So just staying on top of the cleanings. Yeah.
Let's talk through some breastfeeding basics.
Yes. So for families who choose to breastfeed, it's helpful to start the feedings, especially early on, maybe not so necessary after a few days. Definitely the first feeding, there's really good evidence for starting with hand expression and breast massage. So I wish I had a model of a breast, but you can imagine like massaging the breast from the outside of the breast towards the nipple, including the armpit, because there's mammary glands there. So that just kind of helps the milk to start flowing. And then hand expression is just kind of a way to, like, again, babies like have so much to learn early on, including like how to breathe and like how to swallow and do those like at the same time. So for them to just have all the help that they can to get that milk flowing is nice for them. a good resource for hand expression and like breastfeeding in general is the Stanford Breastfeeding Organization. If you like Google Stanford and breastfeeding, you should come upon some really good videos and information. And some other things to help the milk flow is like warm compresses, taking a warm shower, just kind of opens up all the ducts and everything. And then positioning is really important. So if you can kind of imagine, like when we're eating, it's hard for us to swallow and eat if our head is turned the whole time. So like I would have a very hard time like eating my sandwich if my head has to be turned as I'm doing it, like swallowing. So making sure baby early on, again, if they're learning, it is like their tummy's towards your tummy and their face is towards the breast and their neck isn't swiveled. And then bringing the nose to the nipple so that they can kind of sense, they feel with their nose, okay, there's the nipple, and then they can reach up to move their mouth over the nipple. So allowing your baby to find the nipple and having, make sure their mouth is nice and wide, because then that will enable the mouth to be open enough so that the nipple can get to the top of the baby's tongue, like more towards the back of the throat. What that looks like from the outside is that a big chunk of the areola is in their mouth, and then the whole nipple is in their mouth, and that their lips are out like a fish. I'm not doing it very well, but then that means that their mouth is well poised to bring milk out of the breast. The tongue is really involved, so that just allows like the tongue to have room to compress the nipple too, along with the lips. And then you can listen for swallowing. That's a good indication that there's liquid coming out of the breast and that they're getting some. And again, those dirty diapers, really good indication. If you're having, the first day of life, it might just be one poop and one pee. The second day of life, like 2 poops, 2 pees. Third day of life, 3 poops, 3 pees. And then you want to at least see 6 every day. Good indication. And probably the healthcare provider will be weighing your baby early on to make sure as well.
With breastfeeding, I know that not all babies have like a very easy time with latching and stuff. Like in the first, would you say like in the first day of life, the focus should be on like getting them to latch if you're choosing to breastfeed, or like if it doesn't happen the first day, or are you like just destined to just bottle feed your baby? Like is it?
Oh yeah, good question. I mean, it's helpful to really work on the latch and kind of nail that. And not even, I think like the latch can be worked on, but not necessarily worrying about milk supply as much. I think people are like, oh my gosh, I'm producing like a drop. But again, baby's stomach is very small at first and they don't need a lot at one time. They just need to eat frequently. So, and latching is important just because there can be like damage to the nipple tissue, which is like very uncomfortable for moms. And then it can result in sores that then like, even if the latch does improve, just like still painful.
Right.
So that's why it's like so good to have support early on to really try to get that latch working well from the beginning. But yeah, it does not mean if it's not at first, doesn't mean it never will. And just for people coming to us, come in for an appointment, seek out the lactation consultant at wherever you're giving birth. And it's breastfeeding, it can be really challenging, for people who've never done it before. It's not like we grow up doing it. It's something that we have to learn when we're sleep deprived and have been through an intense experience of birth. The benefits of it are that for baby, there's really good immune system support, and it's really good for baby's brain development. And then for moms, there's just decreased risk of breast cancer throughout life. And then like frequent feedings are kind of going to prevent like a breast infection called mastitis. And then for babies, there's like decreased rates of asthma and respiratory infections and ear infections. So great benefits to it. And at the end of the day, if baby's just getting fed every few hours, whatever form that needs to take for each family's situation is different. That's fine. Those are, known benefits of breastfeeding. But we're lucky that we have formula as a resource for when we need it as well.
Great. All right, well, I guess now, after all that awesome information, we can open it up to the chat. Catherine's gonna hop over there so she can take a look.
Yes.
Real quick.
And then next time, this is all about baby, and babies are very important, but also everyone involved is important, including the birthing people and parents and everyone. So the next class will be focusing on everybody involved.
Yes, because even though baby is the star for arriving, a lot of other people need to support. It does take a village, and there's lots of care that has to go into baby, so do not forget.
Right. Yes.
Especially the birthing person.
Yes, so much is happening in their bodies and psyche and everything.
Yeah.
Hi everyone, I am trying to enable the chat right now.
For some reason it blocked off for us. So
okay. From your side, and if you still have questions, you can always DM us on our Instagram or Facebook, and we'll be sure to pass along those questions to Johanna. So I think that's it.
All right. I do have one question before we hop off, and maybe somebody who's logged in has a question as well. With jaundice that you mentioned earlier, is that pretty common? Because two of my sister's kids both had jaundice.
Yeah, very common.
It's very common, right?
It's even termed, there's like physiologic jaundice of the newborn, because just with that immature liver, as the red blood cells, because all of us have our cells that go through a cell cycle, and then they deteriorate, and our liver helps to process them. So if in an immature liver, if there's too much buildup of bilirubin, which is a component of the red blood cells, then it can cause toxicity. So it's kind of something that's normal to a certain extent. We just want to make sure it's not getting to be too much, and we want to make sure that there's not a different cause of that jaundice, that the liver's not functioning well or some other issue. So typically the physiologic jaundice of the newborn shows up around day 2, day 3, but if it's showing up before that, or persistent, getting worse, baby's very yellow, tends to move down the trunk, that yellowness. So in a more advanced case, a more mild case, maybe just okay, my baby's eyeballs are slightly yellow.
I feel it was just their eyeballs.
Yeah.
That's it.
Okay. And that's so, it sounds like it wasn't too severe a case, but if then it was moving down the trunk of the body, and you're there's a lot of yellow going on, that could be more severe. So just any question about that, just check in with the care provider so they can kind of determine, is this something we need to intervene with, or just watch more closely, or
That's great. I think then we'll wrap it up for today about talks about how to best treat baby during the first couple months.
Yeah. Well, thanks you all. Take care, and congratulations.